And let me first define what an AI first culture means to us, which is a bias towards constantly asking for every decision that you make on a daily basis, can AI replace, augment, or teach me something about what I'm trying to accomplish today?
Welcome to Concept to Care, where we hear candid stories of success and failure, discuss strategy, and dive into the details that offer advice on what to do and what not to do in health tech.
Whether you're a seasoned pro, growing your career, or just starting out, our aim for this podcast is to be relevant, real world, and tactical. We're dedicated to not only entertaining you all, but also empowering you with actionable insights that can be applied beyond the podcast, one concept at a time.
This is Angela.
And this is Omar.
Welcome to Concept to Care. Concept to Care welcomes Matthew Wu today. He is the co-founder and chief product officer of Summer Health. Summer Health is the fastest way for a parent to get connected to a pediatrician through text message-based care. They're on a mission to raise the healthiest generation. And in this episode, we're excited to talk about Summer Health's model. And because Summer Health has an AI-first culture, we're going to go deep into AI, and we're also going to get his advice on how to build an AI-first culture. We hope you enjoy this episode. Matthew Wu, hello.
Hey, it's been a minute.
Yeah, welcome to Concept to Care.
Yeah, excited to be here.
Why don't we start with you telling us a little bit about yourself?
Yeah, I like to say I started my healthcare career 30 years ago when I was 3 years old, sleeping underneath my mom's desk because she was actually running IT at the Toronto Sick Kids Hospital. But in all seriousness, growing up, I actually think I have a different story than a lot of founders, which is I actually tried not to do anything related to technology. My dad was a software engineer. My mom was in healthcare IT. But with everything happening around the internet and smartphones and eventually the iPhone, that was kind of the breaking point. And so in college, after unfortunately getting a full-time offer at a consulting firm, decided, hey, you know what, let me try to build a mobile application. I think it was really cool at the time. And fell in love with the idea of talking to users, working with engineers, working with designer, and just building something. It was called Shore Up. It helped businesses identify people that referred their business. Made all the mistakes, didn't know what I was doing, but really fell in love with the process. So, launched, got about 30,000 users, and then shut it down. Went to consulting, realized it wasn't for me, and started to pitch to startups that could help them with their pricing, because that's what my consulting firm did, and landed at Meetup. And they're like, hey, do you want to do this thing called an associate product manager? Again, still didn't know what product management was. Interviewed with it, not knowing what the role really entailed, except for the fact that I'd be working with engineers, and got the job. And so that's kind of how I started my product career. Been in product for more or less the last 10 years. At Meetup, I built out their notification system. Sounds crazy, and I feel really old, but they were like figuring out how to transition from desktop to mobile. And so we had to figure out how to build a notification system. From there, worked with some small startups like high growth companies like Intercom, and eventually landed at Facebook, I guess now called Meta, working on their marketplace product for a bit. And then eventually back to my messaging roots at WhatsApp, leading out their business messaging team. And while I was there, I always knew I wanted to be a founder at some point, mainly because my father was an entrepreneur as well. And it was just something ingrained in me. And so when I got introduced to Ellen and started to learn about her mission to simplify the way in which people access care, and ran a few early MVPs and talked to parents, it was very evident from the beginning that messaging would be a great way to help parents get that instant access to care, especially late at night. I think that's like the worst feeling as a parent, feeling like you can't help your child, whether it be a high fever, or maybe they fell down, or maybe there's a rash that's getting out of hand. And so just being able to help parents in their need was something that attracted me to join Summer Health as one of the co-founders. And 2.5 years later, the team is now 17 people. We're available in all 50 states, and we just raised our Series A, and super excited to continue this mission. And we can talk a little bit more actually about how the mission has evolved, but that's a little bit about me and how I came to be at Summer Health.
Thanks, Matthew. It's a great background. We want to go a little bit more deeper into Summer Health. So could you give us like an overview of the mission, the business model, and maybe a little bit about the platform?
Yeah, so Summer Health is the fastest way for a parent to get connected to a pediatrician through text message-based care. On average, the response time is actually 3 minutes. We have an SLA of 98% of the time people get a response within 15 minutes. And we started off with our mission, which was to simplify the way in which people access care. And that's why we picked this SMS medium. We've learned since then that because it's so convenient for people to use Summer Health, they started to use this for a variety of things, not just for urgent care, but also to ask things about how to sleep train, lactation support, behavioral questions, if their child is falling behind on their developmental milestones. And so we started to add specialists to our platform. We called it Everyday Care. Around that time, we started to ask our questions, well, is there more that Summer Health should be doing? Is it really just simplifying access to healthcare? Or do we have a bigger mission in mind? And not surprisingly, we raised the stakes. No longer is a mission just to simplify the way in which people access healthcare, but it's really to help raise the healthiest generation. And that is the mission that led us to raise our Series A, to really add fuel to what we've built and also tackle new segments of the population, not just people that can afford our subscription model, which allows for unlimited sessions, but actually starting to work with both commercial and Medicaid plans for people that need it. And so that's the next chapter of Summer Health over the next year.
I love your entrepreneurial spirit. And as a mom of two boys, I definitely relate to those late nights when you need help. So I can definitely see a compelling problem that you all are trying to solve. One of the things that Omar and I were most drawn to about Summer Health is your use of AI. So what we'd like to do is cover some AI basics, and then we can go into how Summer Health uses AI. So if you're talking to someone like your grandmother, how would you explain AI in the simplest terms?
I would say that AI, being artificial intelligence, is the idea that we can use machines, or I think my grandma would know what a computer is, to basically simulate the intelligence and thinking and reasoning that a human has. And so that would probably be the most simple way to describe it. And artificial intelligence is, in fact, not a new thing. You could think of the most basic form of artificial intelligence as writing a set of procedures and decision trees inside of a book that maybe an electrician or someone else is using to diagnose a particular situation. It was actually an idea introduced all the way back in the 1950s. And when my dad was, an entrepreneur, he was basically trying to encode expert opinions on mining operations to create expert systems that was effectively artificial intelligence in that age. And so it's really been around for a long time. It's just that each phase of both the boom and the winters, there's always been limitations on what artificial intelligence could do. But I think we're obviously very clearly, with the rise of ChatGPT and transformers, an interesting turning point of what artificial intelligence is and what you need, both in terms of data capabilities, to actually put it into practice. And so, that's a lot of why Summer Health has been so early in embracing AI.
Matt, and I'm sure you get this a ton, and I hope you don't mind me being so direct, but I often feel like in exec meetings or even like exposure to board or investors, I hear like people describe AI in the same way how you would describe software, like AI just does everything and nothing at the same time. And so I know there are very specific use cases and there are different types of AIs. So could you, contextualize for us, like what are some different types of AIs? And then, how is that relevant to healthcare?
I would say that AI is probably like the broader term, and maybe there's some semantics. People might argue the inverse. But within AI, there is one branch, which is the, what people have traditionally thought of as machine learning. And machine learning is basically this idea that you can capture enough information, both in terms of the inputs and the outcomes, and basically create a model that can help predict certain outcomes. And it was mainly focused on, the realm of classification and maybe ranking. And so these are things that were used to do things like helping radiologists help, identify if there's, issues with a particular scan or X-ray, or, Facebook in particular, machine learning for ranking. what was always challenging was that form of AI when it comes to machine learning, it wasn't generalizable. It was very narrow in the types of use cases, and it required a huge investment in terms of the data that you would need to capture, clean, process. You would need really sophisticated teams that really understood the statistics and mathematics behind how to fine tune these algorithms. And so, for example, if you look on, at Facebook, a lot of their machine learning engineers have PhDs. And so the, capital investment for you to make a justification to invest in AI was so high in the past. And what has transformed recently is this idea, and it came with the Transformer, which is a paper that Google wrote a while back. And at the beginning, it was actually not very good at what it can do now, which is generative AI, until it amassed a certain amount of data. And obviously the breaking moment was in 2021 when OpenAI introduced ChatGPT, and people really saw the magic that here is this embedded model that you could just ask questions and it could generate, at that time, just logical outputs that people got really excited about. We can obviously talk about where it's gone from then, but that really opened up people's eyes and lowered the amount of investment, both in terms of data, capital, and skill, and really opening it up for many others and companies to basically leverage AI.
We hear about AI and people have concerns about hallucinations and data privacy and other things. How do you think about key challenges and considerations when you think about operationalizing AI in a healthcare setting?
Yeah, so I think that there is a couple different areas that are maybe not unique, but definitely important to take into consideration in the setting of healthcare. One is the safety of where AI is being deployed. I think right now we are still, not at the benchmarks necessary where AI can truly, be responsible for clinical decisions, especially in settings that are not as clear cut as in radiology, where, there are some studies that have proven that it can be as accurate or in some cases more accurate than radiologists. That being said, when you're talking about a primary care relationship and basically having information that is being interpreted, a lot of that still relies to have a human in the loop. And so, judging the safety in terms of, how much potential harm could it cause to a patient if it hallucinated it's something that we definitely take a lot. And we can talk a little bit more about how at Summer Health we handle that. I think the second thing is we've seen what happens when data is misused from a social media perspective. And so obviously healthcare, that's even more important because it's related to people's lives. And so making sure that, that the vendors and partners that you work with actually handle the data in a way that protects the privacy and interests of your patient is incredibly important. And then I think the third thing to realize is that the use of AI has different levels of risk depending on who the audience is. So whether that be the clinician, a support person, or a patient. And these are factors that you should be weighing as you think about your use of AI.
Matthew, thank you. I think, all that information gives our audience hopefully a basic understanding of AI and generally how it's used. Let's get a little bit more into Summer Health and the application of AI within Summer Health. So how is AI being integrated into Summer Health's platform, and what specific problems are being addressed for clinicians and patients through AI?
I think that, at Summer Health, we really kind of, we shared, the first thing that we did, and we kind of talked about is, the handling of data. And so we didn't go and rush out to use whatever foundational models that were out there, at that time mainly being Google's and OpenAI's, until we were sure that they actually had the right data policies in place. And so it was when OpenAI introduced their BEA, and what that really meant was it had zero data retention. So the minute that you hit it with a particular prompt or query, it would drop the data instead of including it in the training data. From there, we evaluated, well, again, kind of using the framework that I just shared, what is the level of risk to a patient? and where is there low risk but potentially high impact in terms of the efficiency. And from there, we identified a variety of provider use cases in which we could help improve both the efficiency in terms of providers being able to get through the administrative workflow, but also in their quality of care. And we can talk a little bit more about that. I think what's kind of amazing, though, was just how quick it was to get started. And I think that some people in the past have thought that, you need to hire an AI engineer, you need to get all your data and in a row. But I would bet that every startup probably has one or two team members already tinkering with AI. And truthfully, what I did was I spoke with hopefully this is kosher to share, but I spoke with LM like, hey, can you give me your medical records? And are you comfortable if I share it with the foundational model, even though I don't have a BAA? And let me just test what I could produce, right? Could I actually do a proper, medical note? Could I actually, help identify some CPT codes? Could I actually, come up with a care plan and a reminder for you? And the answer was more or less yes, obviously varying degrees of accuracy. And that gave us a lot of confidence to invest more in it. And that was a simple, 2-3 hour investigation with the permission, obviously, of someone to share their information with these models.
I had a random follow-up. You mentioned the BAA and kind of the no data retention. It sort of drops the query. I'm wondering from a healthcare perspective, like the model trains on the information and effectively gets better in supporting the use case. Given that it's not retaining the information, what sort of expectation around the model improving can we expect? Or like, is that even a concern for you all, given the business problem you're solving?
Yeah, I think that we could talk a little bit about how, Summer Health has approached it differently, but we believe the foundational models are just going to get better. And that's clearly not a space where we have the data, the infrastructure, and the expertise to continue to improve the foundational models. But the fact is, since November of 2021, we've seen new models like Anthropic come out, Mistral, all of these different players. And we just continue to believe that it's going to get better and basically, not only say commoditize, each of them are going to have their own thing, but there's only going to be a few players left at the end. Where I believe the magic happens is your ability to actually rapidly iterate and apply these models in a way where we're actually capturing information about the output and whether it is used and the quality of it in the context window that is going to really help. And a lot of that infrastructure to capture, if you were to draft a message that a doctor is going to send, did they use the message? How did they change it? Did the patient actually like the message? Did they respond to it? Did they not respond to it? All that information is information that we capture on our side of the house so that we can continue to fine tune the examples of prompts and teach the model to basically fine tune its style to each provider to optimize for a particular outcome. So that's kind of where we think the magic is happening in terms of the infrastructure we built. And then the second thing I'll say is that since the time of, when GPT first came onto the scene, the context window was, 10,000 tokens. That's maybe 30 pages. Google has announced 1 million token size window. It's probably going to go to 10 million. That's like 3,000 to 30,000 pages of information that you can ground the model with. And I think that's where we're obviously seeing a lot of innovation in terms of how you architect that RAG structure to make it most contextual. And funny enough, it's now pulling in some of the more traditional machine learning tactics to basically be able to retrieve the right set of what they call documents in the AI infrastructure, but information into the context window that can help ground whatever prompt that you are using.
I love the way that you describe the building of the infrastructure. Can you help us to understand? So Summer Health does 24/7 chat-based support by providers to parents. How do you deploy the AI model to help with that workflow?
Yeah, so I'll say that where we started out was nothing real time. It was just, hey, here's a chat that has happened with the patient. Can you draft a medical note? And the reason why we focus on that, first, one, is pretty low risk. Two, we were like, hey, Abridge is doing this, everyone's doing this. I'm curious, like, how difficult is it really to do this? And we did it during a hackathon, and whenever engineers basically put it together in 24 hours. I'm like, wow, this is really good. And he actually worked with a clinician, whenever our head of clinical, to really fine tune the prompt, provide examples. And we were so compelled by it that a week later, we actually launched it into production. And so what happened was we saw that the time it took for a patient to get their medical note and their recommended care plan so that they would know what to do for the next couple of days went from a turnaround of 48 hours to less than 15 minutes. So it's almost instant in that they would actually get their medical note. And I think that's really important and for a parent to feel cared for. Since then, we've started to investigate and understand how can we start to integrate AI in more places. And so the first thing that we actually had to build was a platform that allowed our engineers and clinicians to start coming up with more applications. So the next one that's also pretty low risk is, hey, you're talking to a doctor. How many times have you talked to a doctor and realized you had to repeat yourself? Or maybe you're talking to a specialist and you had to repeat the past medical history. We have that problem because we have specialists. So where we use AI then is, well, when a specialist is talking to a patient that they haven't seen before, we can summarize the past 3 visits for them to get so that they can have a quick understanding of what's been happening, and they would be able to potentially call in some parents like, hey, maybe the reason why they're not sleeping well is because they had this rash. And so we can really improve the continuity of care. And so again, it's not necessarily replacing a doctor, but it's definitely giving them much more important context for them to do it. And then the last thing that we've done is, maybe this is what every healthcare tech company ends up doing, is we built our own EHR. And that's really powerful because it allows us to rapidly deploy these new AI use cases in the right places and actually capture the signal of, hey, did they like that summary? Was it not helpful? If it's not helpful, we capture all the bad examples, we analyze it, figure out what was wrong with it, and then we improve the prompt and the context that we bring into the prompt via RAG. And so I think this is what's unique about the way in which Summer Health is thinking about it.
There is this running theme on our podcast where it feels like every single episode, people give a love note to MedPlum. So I think that you all are on MedPlum, right?
Yeah. MedPlum is great. Reshma and her team are great. I tried to, when we were looking for new offices, I tried to get them to move in with us so that they could help build out some of the features we've been requesting. They politely declined, but no, I really love that team. And everything we've built is on fire, including the data that we pull into our prompts. And so it's pretty incredible because that means that we'll be interoperable, especially as we move into this world where we're starting to be more integrated into health systems and requesting medical records and actually pushing information back.
Yeah, they're on fire. No pun intended. Matthew, you touched on something really important, which is that you had a hackathon and you were able to figure out that you could build the AI model yourselves. I think a lot of healthcare delivery organizations are at that buy versus build decision node. And so was curious if you could talk through that decision-making process. Obviously, Summer Health has invested heavily in these types of engineers. And so was that always part of the strategy, is that you would build it yourself, or have you considered buying AI models as well?
Yeah, I think that I think the first thing to say is that you can't not be investing in this space, right? It's inevitable. It's no longer a decision. It's just something that you have to do. The second question then is, where in the stack do you actually invest your time? As I mentioned, we're not going to be investing in the foundational model. That's not where we think our unique capabilities allows us to leverage the full case of AI. And then the third thing that we consider is, well, how core is AI to what we do? And how are we planning to deploy it? Is it something that we want breadth or depth? And breadth being that like it's going to be used by a lot of different people, or maybe it's like the people that's going to be deployed to. Do we actually have any tight feedback loops with them? And so for us, the answer was, one, AI is core to what we do. We want to continue to be the fastest and ideally become the most affordable way in which people can access care. And 3, we have we're vertically integrated. We recruit our own providers. We have built our own EHR. We can get feedback from them. And so when we looked with all these AI tools out there for healthcare, whether it be, Bridge or Nabla or some of these other ones, it just didn't make sense for us to use those services and be limited in terms of the application, especially when we needed to get really smart and apply 1,000 use cases across our EHR. That being said, one area where we probably may consider buying is probably some AI that's associated with the billing infrastructure, because that's less important to us, right? That's not where we're going to make a differentiation. All we want is to be able to reliably put in claims and get reimbursement. So I think that's probably an area that we would maybe look for a vendor. That being said, we have a very unique model. It's chat-based. We have to create CPT codes based on chat conversations, and there might not be something that exists. So we might be creating something entirely new for that reason. And so we've been exploring that as well in terms of, can we leverage our platform to actually reliably code our conversations for claims?
I like the energy you have when you describe how you're solving some of the problems. I can tell you really appreciate the building of the actual software and platform itself. And you're head of products, so obviously makes sense.
A bit of a bias.
Yeah. And so, you talked a little bit about early stages of leveraging AI. What strategies have you found to be most effective in scaling AI across the organization and as you've grown?
I think that there are two areas I would talk about scale. One is just, for the tools that you do build, how quickly and how accessible can you make it to the rest of the team? Who on your team can actually contribute in terms of continuing to push new applications and use cases based on the foundational model that we put. And we can talk a little bit about what we call Care AI and a little bit about how it works. But the second thing that's really important is that if you're constantly, coming up with new use cases, fine-tuning based on the outcomes of whether people, found the outputs valuable or not, you're going to have to invest into basically evaluation tools. One, for example, has come up that we haven't decided to use that because maybe it's my engineering team's fault. They love to build their own things. Is Autoblocks AI, and so what they do is that when you come up with a new use case, you can ship it. They'll help you track, what a variety of models would come out with the output. You can actually have a human in the loop on your team that can evaluate whether that was a good or bad response, and that way you can run statistical tests to see hey, if you were to run this new prompt or deploy this new prompt, is it actually going to be better than the previous one based on the context that you added into the window? And so I think this is really helpful. And then there's also a lot of open source frameworks out there. I can follow up with you. Actually, I should have pulled that up, where you can basically just run basic reasoning tests, grammar, tone, and the like. And this is really helpful to understand, hey, what are the implications of these prompts? Because effectively, it's like deploying code. It's going to have a direct impact on the actual users because users are seeing the outputs of these models.
Matthew, you've talked a lot about the user feedback, which I love. Can you talk a little bit more about what metrics are you looking at to drive improvement, and how are you really leveraging your clinicians and other types of users to continue to improve these models?
I think right now, truthfully, we want to eventually move towards getting direct feedback from patients as we have more use cases that directly interface with them. But many of it, truthfully, right now happens with clinicians. And so every time we deploy a new use case, we'll first deploy, we have over 40 providers on our platform now. We'll deploy it to 5 to 10, depending on what the use case is. And so we'll actually just get feedback from them. We'll be like, hey, was this drafted follow-up message that we have created for you, was it helpful or not? And it'll be qualitative. We have a Slack channel. They'll give us a feedback. They'll be like, hey, I actually never capital case the names, or I don't use the last name, things like that. Very, explicit feedback. But I think what's more important is to actually capture the implicit feedback. And so what we'll do is we'll track on our backside, how often are they using the output directly? If they were to adjust it, what percentage of the message was adjusted? 3, how does it compare in terms of the time they took to open that chat bubble to send a message? Did it actually improve the efficiency and time? And most importantly, I think we've mentioned this past, like, did it actually lead to a higher engagement with the patient in which the patient felt cared for? Because we actually capture CSAT as well after every conversation. So we understand, did the patient actually find this conversation helpful? And we use all these signals, and I wouldn't say it's automated. We have a data scientist that will basically look at this on a monthly basis and help us give us feedback to then improve and iterate on this problem. I think eventually it should be something that's live and automated. But in the earlier stages, we really want to be intentional about the changes that we're making. That being said, you can imagine that not only are we changing the prompts at a per provider level, but it can also change based on the time of day. And one kind of funny thing that we learned was that providers are more likely to send what's generated via the AI, make less changes when it's late at night. Not surprisingly, that's actually not a behavior we want, because that's probably because the doctor's just really tired. They just want to send the message and go. So that's a behavior that we had to correct, and something that we wouldn't have heard via explicit feedback. They probably loved it, but implicitly we knew that it wasn't necessarily, they were sending it too fast. There's no possibility that they were able to read and decide whether this is the right message to send. And so those are things where we had to turn it off in those cases. And so these are things where we're constantly iterating and learning and making sure that patient safety in terms of what's being sent is still very much top of mind, even with the human in the loop.
Matthew, one thing I appreciate about you, like as you've been talking on the show, is patient safety has been pretty much top. I have heard it a couple of times come out of your mouth, and how Summer Health is leveraging or like thinking about that. So I want to ask you, let's dive into AI ethics and patient safety a bit. So what are some ethical guidelines that Summer Health follows and when developing technology?
Yeah, I think that the most important thing for me is truly, like, one, their safety in terms of, are we misrepresenting the care that they're getting, that they're frankly paying for? And also, is the advice going to cause, adverse harm, in the same way that, we track things like prescription rates, because we want to make sure that our doctors are not overprescribing, especially in the field of pediatrics. And then the second thing that is really important for us is privacy. Is the information being used in a way that the patients are not aware of? And as we develop these technologies right now, much of it is on the clinician side, and we're not training this data for any external purposes and whatnot. And so, we have been very careful with that. But, in the future, if we were to be more explicit and be like, hey, this response was actually generated by an AI and there was no edit, that's something that we want to make sure that the patient knows. And it was not reviewed by a human. I think that these are definitely, tricky areas, because, how much is a human really going to trust in AI? And I think that that's something that we need to prove over time. Although I think there's different frameworks of how we eventually get to the point where people feel comfortable with it. And then same thing with privacy. If we're going to be using their data in a way that's going to be not just benefiting them, but maybe benefiting all of our users, or maybe it's something that we're using to train some diagnostics, I think that's important to make sure that they're aware that their data is being used in that way. I would say right now, that's not something that we're doing, and so we're not explicitly asking. But at some point, it's definitely an opt-in. I think everyone should have the ability to make that decision for themselves.
It sounds like there's tons of exciting problems for you all to solve. Where do you see the future of AI in healthcare heading, and what types of innovations are you the most excited about?
I think right now, where healthcare AI is being deployed, and frankly, it's where we started out, is a lot of the low risk, high effort administrative workflows that doctors have had to deal with. In fact, my wife is a dermatologist, so I see this firsthand when she comes home and she's still writing medical notes. I think that's great. It's going to allow them to have more time with patients. But I think where I'm really excited for is when AI is truly a co-pilot with doctors. And that's something that we're starting to explore with already with us, especially a chat interface is very conducive to having a doctor have an AI that's going to know the entire medical history, make sure if a doctor is asking questions that isn't answered already because we have that information. And so this is something that we're exploring with, but I'm really excited for that to happen, not just in a telemedicine platform, but also in real life. in person. On the patient side, I think it's been helpful, obviously, to be able to ask AI for questions on particular topics and get answers. But I think it's going to be really exciting when AI can truly provide, a deeply personal care plan based on your particular goals. And I think that it requires a little bit more than just a prompt. It requires your ability to actually index all the information from a medical record, be able to index, what are some of the studies that have gone out there? And ideally, in the future, if there's a large enough sample size, understand, hey, for a parent that comes from maybe a particular ethnic background, or maybe they had a premature early birth, like these are the things that you should take in consideration that just doesn't happen right now for physicians because they don't have the time to really think through all of that. And I think the second thing is, AI shouldn't just be giving you answers. They actually should help you do things on your behalf. I spoke with a patient in Medicaid, and she spends like hours every month trying to get an appointment. And every time she gets into the front desk, they're very dismissive and rude to her. And so she wants to get to that appointment, but she can't. And she's a working mom, and she works from 7 a.m. to 7 p.m. and she's taking time every day. Like, why can't AI help her book an appointment? I think there's use cases that are not necessarily healthcare based in terms of it's giving you medical advice or assistant, but it's actually helping you get things done in the real world. And I'm really excited for that as well.
That's great. I'm hearing you say maybe address some social barriers that people encounter that are very real barriers to healthcare.
I mean, some of these patients have to remember, if they want to get to the well child visit, they need transportation. You need to fill out these forms 3 days in advance. You need to have all this information on you at any given time. Like, why can't we just automate all of that so that you can just show up there and just kind of like how you go through TSA pre? So these are just things that I think people think AI is just this bot that gives you answers. No, AI can do things in the physical world. We just have to enable it.
Matthew, I've seen you doing the circuit. I've seen you talking about AI in multiple different venues. Obviously, clearly, you guys are leveraging it in many different ways, solving a lot of use cases. Your hiring has signaled that you guys are leveraging AI, so it only makes sense to talk to you about it. So it's very clear you have a culture, like a very strong culture around AI. So I want to talk to you about building kind of an AI first culture. First off, what just inspired you guys to adopt this AI first approach at Summer Health? And like, what are the tactical things you guys did to foster that culture to really bring it to life?
I think the reason why we were so fast to move towards this opportunity was when we first started Summer Health, I had this hypothesis. I had, hey, if we're going to deliver care via messaging, it's going to be incredibly affordable. We're going to have mass amount of volume. And we would have all this unique data because it's not like some audio or like in-person interaction with the doctor where you're not capturing any of that information. And we could eventually build this medical co-pilot, and literally called it that, 2.5 years ago and before GPT. But I thought it was a 10-year vision. I thought that it was so far into the future, and we just had to get the basics right. And on November, I think is it 21st that it launched? I think roughly that was the day that ChatGPT launched. And I saw what it was capable. I'm like, wow, the future is here. Like, we can literally do this now. We don't have to wait. And so I had a few friends that worked at OpenAI and immediately called them like, hey, when are you guys going to have a BEA? Like, I need this technology. And so as soon as January, they were starting to work with a few healthcare companies, typically larger ones. But they said, hey, we would interested to hear kind of what you're planning to use it for and whatnot. And that's how we got that early BEA. I think we're probably the first healthcare startup to have a BA with OpenAI. And this is before they were charging. Like, it was free, which is great because you got to play around with it. The reason why I share that is not a playbook that you can roll out with other companies, but I do think it points to a few tactical things that people can do to kind of kick off, an AI first culture. And let me first define what an AI first culture means to us, which is a bias towards constantly asking for every decision that you make on a daily basis, can AI replace, augment, or teach me something about what I'm trying to accomplish today? And the reason why it encompasses those three things is that it's not that AI is just something that we deploy to our users. AI should fundamentally change the way in which and how we build, and therefore what we build. I do think that tools shape us, and therefore we kind of need to embody that. So tactically, the reason why I shared that story, first off, is that there's already someone in your company that loves AI. They're probably automating like 50% of their job. And you just have to put out the feelers. These are the people that are posting your Slack, the tweet storms and tweet threads about the latest AI and how it's benchmarking. Like, this is the person that you want. Second is, get a quick win in terms of being able to prove the value. And I shared a story already earlier that I literally just asked one of my co-founder, or you can ask someone on the team, like, hey, can I just share? I know it's sensitive information, but can I share your information with these models and just see what's possible? I think people are going to be blown away that within a couple of hours, you were able to accomplish something that they didn't think was possible. That really gives you a strong proof point. And then the third thing is, I do think a hackathon is a great way to get people aware of it. And so ahead of time, obviously show them the quick proof point that you have, put together some YouTube videos of explaining kind of how it's been used in other places, and some rough kind of themes, and have the team kind of work and hack on a few of these models. Give them some mock data. There's a lot of public anonymized healthcare data out there that you can use. And I'm sure coming out of that, there's gonna be one or two ideas where you're confident, like, hey, tomorrow we can go launch that. And so I think that that's a really great way to, get a spark, then a flame, and then eventually something that just stays within your company. And at least that's how I've done it. And I've heard a few other companies had a very similar story in terms of how they got AI really going at their company.
Matthew, I think that Summer Health has a lot of really top talent, and it's probably an area that you invest heavily into. How do you think about talent, and what skill sets are you looking for as you continue down this AI forward path?
Truthfully, kind of as we mentioned, in the past, it was a strategic decision whether you should invest in AI. You needed to have enough data, you needed to have the infrastructure, you probably need to have a data engineer, then you would need to have a machine learning engineer to get going. I think that's not the case in this world. In fact, where we've been spending a lot of time talking about AI is at the application level. And so really what you need is product engineers. And I would hope most companies have product engineers that, are obsessed with building great software. I think it's, using AI is going to be the same thing as using Figma. There's no way that you can build software without using Figma or that without using AI. And so I don't think it's a unique skill set that you need to acquire. That being said, as you do scale, I do think it's important that there is some AI infrastructure that you want to build so that you can properly accelerate the deployment of different AI use cases and also do the evaluations, as we mentioned. And yes, maybe if you're big enough, you might want to bring back some of that traditional machine learning engineers or people that really are at the forefront. But the reason why I answer in this way is that there shouldn't be an excuse not to get started today. You don't need to bring in someone to teach you. It's something that you should be able to just get going.
I love it. I think I hear a lot of reasons why not to. And for you to say, if you have application engineers or product engineers, like, you should be able to deploy something. So we've hit a little bit, you've talked about like building the culture and the tactical things around that. And I think that's incredible advice. What advice would you give to other healthcare startups looking to integrate AI into their solutions?
Yeah, I think first and foremost, make sure that, depending on what the use case is, make sure you're working with the right partners, and make sure that you're actually following the compliance standards necessary to protect your patient's information. At the end of the day, like that, without that, you have none of your patient trust, and therefore you're not actually delivering quality care and protecting your patients. So first, make sure that you're working with the right partners. Make sure to sign those BAs. I know they can be expensive, but it's important. And then from there, the second thing is, it sounds pretty basic, but there's a lot of, I would start off honestly just to, get started. Watch a lot of it sounds silly, but like literally just search YouTube tutorials on the use cases of AI. Andrew Ning has a great one. I watch a bunch of Lang Chang LangChain is a little bit difficult to deploy at scale, but it's really great to get started and testing. Like just watch all the videos and you start to get a sense of what's possible. And then, assuming that you can get some of that under your belt, every week there's a new paper being released. And so fortunately we have our head of data science here that's constantly sharing these papers because I can't read them all. But, start getting smart about what works and what doesn't work. And finding out some of these papers are not like mathematics. Literally one paper is talking about chain of reasoning, where you put in basically what strawberry is, but like pre-strawberry, which is you literally put the instructions of what you want the AI to do and what's the best way to format that and achieve certain results. And so I think that people are really daunted by the aspects of getting AI started. But I think, again, in this day and age and all the resources out there, take baby steps. But once you get a few wins, start running at it.
You mentioned the Strawberry model, which is OpenAI's new model, codenamed Strawberry, maybe a month ago now. These models, I feel like, have just evolved so quickly. And how do you think about those advances and the accelerated pace of the development?
I'm excited for it. I think that a lot of what we were trying to do with all the chain of thought inside of our prompts is more or less some of what Strawberry. Now, Strawberry doesn't include all domains and it doesn't have access to all the sets of information, especially health information for that matter. So if it can do and have that reasoning already built in, then, with our unique data set, I think we're even to get better results and better capabilities. And I think that there's this fear of AI replacing jobs. And I'm sure, it would be a lie to say it won't, but at the same time, it's going to make even more personal software and delivery experiences that just wasn't possible before. And that's going to require even more effort. And so I'm excited for that future. And my wife, who's a dermatologist, always says like, hey, if AI can help identify rashes, great. Then I can really focus on the complex patients that really need my focus and attention.
I love it. I love the perspective. All right, Matthew, we're at our very exciting concept closing call. It's meant to be fun, fast paced. Angela and I are just going to rattle off some questions. First off, are there any frameworks, methods, or processes that you've found especially useful in your work and that others who listen to this podcast might as well?
I think being a startup, the most common framework I use is one from Bezos, type 1, type 2 decisions, type 1 being decisions that are big and irreversible, and type 2 decisions that are reversible. And I would say 90% of the time, your decisions are reversible. So just make it, move on, learn, and get going. I think too many people think their decisions are type 1, but it's not. And so as a startup, our only advantage is speed. So let's just get going.
Is there a tool that is highly valuable to you that you think others may not be using and should?
Yeah, I really like this tool called Voice Notes. It's kind of like a voice memo app. You just record whatever thoughts you have. It does a really good job at accurately transcribing it. And then it has some pre-built actions to like summarize your thoughts into bullet points or write it into an email or clean it up. And so I found it was a great way for me to just get my thoughts out quickly and share it with the team. The other fun thing that I've been doing recently, I don't know if you've seen this trend on YouTube, is people buying like e-ink Android devices. And so they're kind of like your smartphone, but it's all in e-ink. And so it's like less addictive. I only install reader apps and, YouTube and things like that. And it's been really helpful for me to focus. So when I come home, I just put my phone away, like my iPhone, and I just use this e-ink Android device to do Duolingo and, read Kindle and read my Read It Later app articles.
E-ink, like E-dash, like E-I-N-K? Like
like a Kindle? Yeah, it's like a Kindle. The brand is called Books, Boox. I've really enjoyed it. I know that people can't see it, but this is kind of what it looks like. This is like a e-ink,
cool.
Sweet.
device.
A new toy.
It's like how people are going back to the flip phones or just phone calls and text messages.
Yeah, it looks like that. So I got my Duolingo. Sometimes I even do my Peloton.
Wow.
The Voice Notes app is the one right next to the Audible app.
Notion.
And I can listen to audio.
That's incredible. That's so cool. I do, Angela, you mentioned flip phones. I miss Blackberries. I felt so important with Blackberries, and it did nothing.
Yeah.
Just like email,
Yeah.
BBM. Nobody probably feels the same way I do. I promise I'm a millennial.
Yeah.
Okay. Are there any concepts in healthcare that excite you, Matthew?
I think it's been really amazing to see how fast AI is being deployed at scale. I think I'm genuinely excited about that. And people might be like, oh, aren't you afraid they're going to eat your lunch? Maybe. But at the same time, I think it's net positive. I think more care is better care in this day and age. I think that, I'm excited about a world where if we can capture more longitudinal data, like we can actually provide more routine checks for people in an convenient and accessible and delightful way that just wasn't possible before. I think it's kind of crazy that, people only see their pediatricians like once a year, and this pediatrician is supposed to know everything about you. I'm like, how would they know anything? They've only seen you every 12 months. And so how do we have a better touch point so that we can help children, especially in this day and age where mental health and behavioral health is such massive issues. So I'm excited about how AI can do that, because in the past, it just wasn't possible, because even if you capture that information, you could do nothing with it. But in this day and age, I think you can create deeply personal experiences where people feel like they're not just giving you information, but they're actually getting value immediately.
Love that. Do you feel like product management is a science or an art?
I think that product management is very much starts off with art, in that it's subjective. It's understanding what users need and making an hypothesis. But once you make an hypothesis and you put something out in the world, it becomes a science in which you'll very quickly see, is it going to work or not going to work? And you have to take that feedback and iterate and keep on going. It can't be one or the other. It kind of has to have a combination of both, and unless you're Steve Jobs.
Last question. Where can people get in contact with you if they wanted to reach out? And do you have any shameless plugs?
Yeah, shameless plug number one. We are looking for a VP of engineering. We just hired a team, and we're really excited about our future. And so if you're interested, reach out to me at matthew@summerhealth.com. I've been really bad at posting on Twitter and LinkedIn, but that's one of my, half-year goals. And so I'm going to start doing that more regularly. So, if you enjoyed this, just follow me on Twitter at Matthew Edan, Edan, Wu, or LinkedIn. It's pretty easy to find me. And yeah, try out Summer Health. I think I'll keep this code available for the next month or 2 months. So if you sign up, use the code summertime and then try it out. Let me know what you think.
Matthew, thank you so much for coming on the podcast, and really appreciate it. It's been fun.
Yeah, no, thanks for having me, Angela and Omar. It was fun to chat with you guys.
Awesome.
Thanks, Matthew.
Hey, thanks so much for listening to the show. If you liked this episode, don't forget to leave us a rating and a review on your podcast app of choice. And make sure to click the follow button so you never miss a new episode. This episode was produced and edited by Marvin Yue with research help from Aditya Treya. We're Angela and Omar, and you've been listening to Concept to Care.